Hi, I am Dr. Sherly Mathen, Senior Consultant, Aster Medcity. Today, I will highlight you with a few tips when a pregnant lady comes to hospital for checkup or any other consultation during this COVID times. As we all know, coronavirus is responsible for the COVID disease and it spreads through person to person contact and through the droplet infection. So we have to do things to prevent this spread. How we can do it and what are the precautions we should take. We all know that vaccine is available and vaccine protect us to some extent. It does not completely protect us from getting the disease, but if you have the disease, the severity of the disease will be much less. So even if you are protected with the vaccine, that is 2 doses and the booster, still you must continue to use the mask. So what type of mask are you going to use and how are you going to use it? The type of mask I will recommend will be a N95 mask. If you are using a cloth mask, you have to make sure the fabric you use should be thick. It should not allow any particle to pass through it. How can you confirm this? If you hold that material or the fabric against light, you should not be able to see that light. But if the fabric is thin, you can use 2 disposable masks inside, and over that this cloth mask can be used. When you wear the mask, what are the precautions you will take? You have to breathe through the mask. There should not be any gap between the face, between the nose. So it should be well fitted so that no other air or the particle can enter or you can breathe air from the outside. So using the correct mask, correct type of mask is very, very important, and that is the only thing that protects you from getting this corona disease. What is the other important thing we have to do? We have to use a better sanitizer and hand hygiene. So if you are not using the sanitizer, you have to frequently wash your hand with soap and water at least for 20 seconds. Or when you are outside, you can use sanitizer which contains at least 60% of alcohol. There are some people who are allergic to this sanitizer. For those people, it is better to use a glove and over which repeated use of sanitizer can be done. So these few simple things has to be followed by each and every one. It will protect you and also your colleague or who are the people next to you. So when you come to the hospital or you are taking care of a person with the COVID infection, or for the health workers who are dealing with people with COVID infection, it's better to use a face shield. It will not protect like a mask because there is gap, but at least direct spread can be prevented or more of it can be taken care. So what are the other precautions when you are coming to the hospital? Of course, one of the most important is try to avoid public transportation. If you have your own vehicle, that is the best way to come to the hospital. And who will come with you? It should be somebody who is free of the disease, who is healthy, so that there is no other spread while you are in the hospital. Then you should not come to the hospital for very meager complaints. Try to come when you have a genuine complaint so that the exposure to the disease is avoided. And when you reach the hospital, you have to make payments. For this, probably you can go and get the online payment to be done to avoid the touching the currency or any other bill or any other things. Other option, if you don't want to come to the hospital for small complaints or when you want to clarify some doubts with your doctor, the best is the teleconsultation. This facility is available in our hospital. You can choose your same consultant and you can book online for a teleconsultation. Now let's see what is the type of care you will take in your own house or own home. First and the most important is food. So try to eat your homemade food. All types of food are welcome. Try to eat a balanced diet avoid fatty food and fast food or food from outside. Always, even when there is no corona problems, it's better to eat a healthy, balanced diet. You may be seeing many advertisements about the Immunoboosters. My advice to you is don't binge on these Immunoboosters. So anything too much is not good for your health, especially pregnant ladies. Another thing, important thing, especially pregnant ladies to take care is not to go for any functions as long as you can avoid it. Of course, you have to avoid crowding, any visit to the malls. These are the places where the maximum spread of the disease is seen. Suppose you get this disease, what are the other options you have, the latest option? We have got a monoclonal antibody which is called as a cocktail. This is containing two types of antibodies which will prevent the multiplication or the invasion of the virus into the cells. These are expensive. This is usually given to people who are very vulnerable, who are elderly, who have got other comorbidities like cardiac disease, lung disease, and this can be even taken by the pregnant ladies if they have many other comorbidities. This is expensive. It's available in the private hospitals, and the government is also giving this cocktail treatment. So my advice to all of you is, if you are tested positive and you are pregnant, don't panic. If you don't have any symptoms, you can still stay at home, take rest, do a teleconsultation. And only when you develop some symptoms of breathlessness, then you have to come visit the hospital, and maybe you will have to get admitted and take the further treatment. So all of you will stick to all these tips and stay healthy. Thank you.